So Joe Biden just recently signed the Global Health Security Strategy. Now, you thought that the Pandemic Health Treaty, which gives away our sovereignty, was scary. Well, this is almost as bad. They're basically going to be hunting down pandemics. Let me just read to you from this PBS piece here. Starts off, Biden administration announced strategy to combat future pandemics with 50-country partnership. Says President Joe Biden's administration, with help of 50 countries, with the help of 50 countries, will identify and respond to infectious diseases with the goal of preventing pandemics like the COVID-19 outbreak that suddenly halted normal life around the globe in 2020. It wasn't the virus itself that halted the globe. It was politicians who decided to halt the globe, right? U.S. government officials will offer support in the countries, most of them located in Africa and Asia, to develop better testing, surveillance, communication, and preparedness for such outbreaks in those countries. Great. So they're going to be hunting the Congo for viruses. And then they're going to say, oh, we found one. We all have to lock down. We all have to lock down. Says the strategy will help prevent, detect, and effectively respond to biological threats wherever they emerge, Biden said in a statement on Tuesday. Okay, so the strategy will help prevent, detect, and effectively respond to biological threats wherever they emerge. We know exactly what that means, right? That is that they're going to be hunting down disease X, which is what the WHO called it during their Davos meeting, where they're like, we got to be prepared for disease X because disease X is going to get us all. Let me just read this. This is from the White House. They released a press release on this. I just want to read part of this to you. The COVID-19 pandemic had and continues to have a profound impact on our nation and the world. More than 1 million Americans have lost their lives and nearly 7 million Americans have been hospitalized, leaving families grieving and communities forever changed. We experienced the worst economic crisis since the Great Depression as weaknesses in our supply chains were exposed. Small businesses struggled to stay afloat and 20 million Americans lost their jobs. Again, not because of the actual virus. No, it wasn't that. It was the government's response. But they're trying to say, well, it was the virus that did this to us. So we have to, even though it was our response that caused all the chaos, we need to get ready to respond again so that we can cause more chaos. Says we saw how this global health challenge caused local consequences for our hospitals, our schools, and our communities. No sector of the community or society was immune, right? Because of you guys. This is why, since day one, I've been committed to ensuring that our nation is prepared for a future pandemic, here it is, and biological threats, including strengthening and investing in global health security. Over the last 3 years, we have more than doubled our global health partnerships, working directly with 50 countries to ensure they can more effectively prevent, detect, and control outbreaks. And we are working with partners to support an additional 50 countries to save even more lives and minimize economic losses. With strong bipartisan support from Congress, we also champion the creation of the Pandemic Fund, a new international, here's this, the Pandemic Fund, okay, get this, a new international body that has already catalyzed $2 billion in financing from 27 contributors, okay? Who are these contributors? Countries, some of them are countries, foundations, and philanthropies. What do you want to guess? Bill Gates. Bill Gates Foundation is one big one there. They're going to build a stronger global health security capabilities. That's the aim of these foundations and philanthropies and countries, to build stronger global health security capabilities. This, when you start taking the money, you start getting into these organizations that have an ulterior motive, right? They've got their own agenda for what they want to see. We know what the Bill Gates Foundation wants to see: vaccines for everybody and surveillance for diseases in order to enact vaccines for everybody. And now they're working with these countries that are in these poor parts of the world, where they can manipulate them and say, we're going to give you a bunch of money, right? Not just for this. They're giving them a bunch of money for other why are these countries signing on to this? There's a reason for it. So they're getting some sort of grease, some in order to do this. And in exchange, the powers that be who want to implement these COVID passports and vaccine mandates on us are going to be then saying, well, we found a new disease. Yeah, it's a bad one. Ooh, people are dying. They're dropping dead in Africa. This is just absolutely frightening. I want to read this to you. This was Paul Thacker. He's a journalist. He's been reporting on a lawsuit that's happening in Finland where, get this, a WHO official seems to have admitted that vaccine passports were a scam. Let's go ahead and read from this. Saying the WHO official admits vaccine passports may have been a scam. The World Health Organization's Dr. Hannah Nahanik testified in court that she advised her government that vaccine passports were not needed but was ignored, despite explaining that COVID vaccines did not stop virus transmission and the passports gave a false sense of security. The stunning revelations came to light in a Helsinki courtroom where Finnish citizen Mika Vakala is suing after he was denied entry to a cafe for not having a vaccine passport. Dr. Nahanek is a chief physician at the Finnish Institute for Health and Welfare and serves as the WHO's chair of strategic group of experts on immunization. Testifying yesterday, she stated that the Finnish Institute for Health knew by the summer of 2021 that the COVID-19 vaccines did not stop virus transmission. During that same 2021 time period, the WHO said it was working to create an international, I clicked on the wrong thing. Let me just get back to it. Create an international trusted framework for safe travel while EU member states begin rolling out COVID passports. So they knew already it didn't stop the spread, but they were still like, yeah, get those COVID passports going. The EU Digital COVID Certificate regulation passed in July of 2021, and more than 2.3 billion certificates were later issued. Visitors to France were banned if they did not have a valid vaccine passport, which citizens had to carry to buy food at stores or to use public transport. But Dr. Nahanik testified yesterday that her institute advised the Finnish government in late 2021 that COVID passports no longer made sense, yet certificates continued to be required. Finnish journalist Ike Novikov reported the news yesterday after leaving a Helsinki courtroom. They knew it was an absolute scam. They did it anyway. It wasn't because they really worried about our health. It wasn't because they really were worried about the spread. They knew that these vaccines did not stop the spread. We've known that from the very beginning. We knew that coming out of Israel. They were the first country to get vaccines. They vaccinated practically everybody. And then they were like, oh, crap, the first two didn't work. We're going to need a third. And by the time they were looking at a fourth is when the rest of the world was talking about vaccine passports. We already had the data. We already knew, but they forced it anyway. That's because it wasn't ever about really, truly stopping the spread of our health. And that's why this new little global treaty or whatever that Biden has signed that looks for viruses in 50 different countries, that's not about our health either. We all know that this is about coming up with a way to surveil people, to get people on passports, on some sort of surveillance systems. It is absolutely frightening. So it's just another. So there is another one. It's not just the pandemic treaty that we have to worry about. It's now this, global health. What are they calling this? The global health security strategy, right? That is in cahoots with philanthropies and organizations.